Assalamu alaikum warahmatullahi wabarakatuh. First, I want to introduce myself. So, my name is Saadi-alamri and I'm a medical physics student. Today, I'm going to talk about the type of radiation exposure situation. Here we have the outline. First is the type of exposure situation, then the categories of exposure, and the dose, constraint, and reference level. We are going to present the definition of them and comparing them to each other to know the difference between them. First, the type of dose restrictions. Planned exposure situation is a situation where the radiation protection can be planned in advance before exposure occur and where the magnitude and extent of exposure can be reasonably predicted. So this type is planned before exposure and the result of this exposure can be predicted. Here we have three types of planned exposure situation. The first is working in a hospital, like the doctors and radiologists and engineers and the RSO. Second, the work in a uranium mine and working in a nuclear power plant. Exciting exposure situation. These are exposure situations that already exist when a decision of control has been taken. Include prolonged exposure situation after emergencies. Examples: exposure of aircraft crew to cosmic rays, exposure to radon dwellings and workplace, because radon gas existing everywhere, and exposure to naturally occurring radioactive materials, exposure in contaminated territories after nuclear accident or radiation emergency, exposure in contaminated sites from past activities. The third type is the emergency exposure situation. This situation that may occur during the operation of planned exposure situation if loss of control or breakdown of radiation protection occurs. And these exposure situations are not planned and exposures may not be applied to controlled. We have some examples here: the nuclear reactor accident, the accident with the radiation sources, and the accident outside the country with transboundary effects, because air can carry the gases and the radioactive materials from place to another, and malicious acts involving radioactive materials, loss or theft of dangerous radioactive sources. Here we have the categories of exposure. The first is the occupational exposure, and it's the exposure of workers incurred as a result of their work. Second is the public exposure, exposure of members of public other than occupational and medical exposures, and not including the normal local natural background radiation. The third is the medical exposure, exposure of patient part of their diagnosis or treatment, volunteers helping in the support and comfort of patients. and volunteers in biomedical research. So now we have the knowledge, and we can comparing the difference between the type of exposure situations and the categories of exposures, and we have the knowledge about usage of them. The categories of exposures and the exposure situation are used to consider who best to approach radiological protection different circumstance. Dose constraint and reference level. Here we have the definitions of the dose constraint and reference level. Dose constraint definition: a prospective and source related value if individual dose constraint, or risk constraint that is used in a planned exposure situation as a parameter. So the dose constraint is used in a planned exposure situation as a parameter. The reference level is an emergency exposure situation or an exciting exposure situation. So the reference level used in emergency exposure situation and the exciting exposure situation. This table show up the usage of dose limits and dose constraint and the reference level. Here we have the planned exposure situation. In occupational we have a dose limit and dose constraint. In public we have a dose limit and dose constraint. But in medical we have a diagnostic reference level. Then we have the emergency exposure situation. In occupational we have a reference level. In public we have a reference level. And in medical it's not applicable. Then we have an exciting exposure situation. In occupational we have a reference level, and in public we have a reference level, but in medical it's not applicable. Here we have the ICPR approach. On the right we have the emergency and exciting exposure situation. First we have the reference level to guarantee the optimization, and in the left we have the planned exposure situation. First we have the dose limit, then the dose constraint to guarantee the optimization. So this is a quick test to testing yourself, and I hope you all enjoyed this presentation, and thanks for watching and thanks for your attentions.